Hi everyone, today we are going to see yet another video on next generation NCLEX RN type questions with answers and their explanation. Now in the recent NCLEX RN exams, a case scenario will be given and you will be asked nearly 6 number of questions following that. So here I am giving you a case scenario and based on that some questions are following. Mr. Jose is a 67-year-old man admitted after an acute cerebrovascular accident. The patient has a history of well-managed hypertension and atrial fibrillation. He lives with his wife of 59 years and was functionally independent prior to admission. Both husband and wife speaks Hindi and carry on simple conversations in English. The patient now presents with right-sided weakness and aphasia and placed on 4 new medications including an anticoagulant. He is seen by various members of Interprofessional Care Team (ICT). So here one patient's condition is given and also some sentences like the patient is not able to communicate in English, and also there is a collaboration between the team members is given in the scenario. So let's see the question. Which phase of care is most critical for medical surgical patients? Seeing the options, first one acute hospital phase, second one pre-hospital care phase, third one transition phase, and fourth one discharge phase. So which is the most critical care for medical surgical patient? Which phase? So we know that all these phases are important, but the most critical, the answer is transition phase. You know that the safety of the patient is at risk during transitions between care settings, particularly following an acute hospitalization. The patient's needs may go unmet and there is the risk of medication errors and adverse clinical events. Readmission rates of hospitalized patients can be prevented if we are doing much care in the transition phase. In US and some other countries, insurance companies even deny the reimbursement or they may charge penalties for readmissions within a particular window period. Unplanned readmissions after a recent hospital stay, it measures the quality of the hospital care. So transition phase is the most critical phase for medical surgical patients. Moving on to the second question. What is considered the patient's span of responsibility? Hospital span of responsibility for the patient. So how much days the patient is responsible under the hospital? Admission to discharge, admission to 30 days post-discharge, admission to 15 days post-discharge, admission to full recovery. That means till what period the patient should be free from any readmissions to the same hospital with the same condition or its complication. The answer is admission to 30 days post-discharge. Moving on, what is the focus of transitional care programs? Select all that apply. Supporting the patient after hospital discharge, coaching and teaching to enhance patient understanding, providing patient-centered discharge instructions, ensuring evidence-based medical therapy, providing adequate pain control during hospitalization. So, what is the focus of transitional care programs? So, the first one is supporting the patient after hospital discharge. So even after discharge, the transitional care nurse should be supporting the patient. Next, coaching and teaching to enhance patient understanding regarding the medications, regarding the activities they need to do when it's the follow-up visit. All this coaching and teaching need to be enhanced and it should be understood by the patient. Third one, providing patient-centered discharge instructions. So that is also a part of transitional care program. Applying evidence-based medical therapy and providing pain control during hospitalization is not a focus of transitional care programs. What role does the nurse have in transitional care programs? Select all that apply. Directing patient care in inpatient setting, coaching the patient after discharge, managing chronic conditions after discharge, directing patient care in the clinical setting, assessing the patient's risk for readmission. So what role does the nurse have in transitional care programs? You know that first one is the coaching the patient after discharge. Already previously we have told, in order to prevent readmission, we have to train the patient, that is coaching the patient after discharge. Next, managing chronic conditions after discharge. There should be telephonic conversations also with the transitional nurse and the patient so that when any complications arise, the patient will be directed to the hospital. Third one, assessing the patient's risk for readmission. That is also an important role of a nurse when she is a transitional care nurse. Thank you so much.